So we will move on now to House File 569, Representative Morrison. Would you like to move your bill, Representative Morrison?
Thank you, Madam Chair. Yes, I would like to move House File 569.
Okay, so Representative Morrison moves that House File 569 will be recommended to be laid over for possible inclusion in the finance bill. And members, there is another bill as well that we is not actually a filed bill yet, but we sent the language out to everyone that goes along with this discussion. So essentially informational only, but because of the difficulties this session yet with getting bills through the process and introduced, we thought it would be good to talk about both of these at once. So just hope to have a good general discussion and get an understanding of where the finances are with this. So with that, Representative Morrison, please present your bill.
Thank you, Madam Chair. Madam Chair and members, I appreciate the opportunity to present these two important tobacco prevention funding bills that offer different ways to solve the same problem. Reducing tobacco's harm is a public health success story. Today, we all enjoy smoke-free air, and tens of thousands of Minnesotans have broken their addiction to cigarettes. Unfortunately, though, our work is not done. As a physician and a mother and an elected official, I am deeply concerned about smoking and the epidemic of youth tobacco use. We were so close to raising a generation free from tobacco addiction. In 2019, youth cigarette smoking fell to the lowest levels ever recorded. E-cigarettes have created a whole new health crisis among our kids and young adults. And smoking rates remain high in communities targeted by the tobacco industry, including Black, American Indian, and LGBTQ people. Every year, Minnesota loses 6,300 residents and $7 billion to smoking. And with 1 in 4 Minnesota 11th graders vaping e-cigarettes, we face untold costs of future addiction. Decades of research have detailed the harms of cigarettes. Smoking harms nearly every organ in your body. That is particularly concerning as we navigate the COVID-19 pandemic. Current or former smokers are at increased risk for severe illness from COVID-19. To make matters worse, communities targeted by the tobacco industry are some of the hardest hit by COVID-19. We do need to do more to reduce smoking and youth tobacco use, starting with investing more in tobacco prevention and treatment. As a part of the 1998 tobacco settlement, Clearway Minnesota was created. They have provided the vast majority of tobacco prevention and treatment funding in our state. Clearway will sunset at the end of this year, leaving a significant funding gap. The time is now for us to address this cliff. Tobacco taxes and settlement fees are a huge source of revenue in Minnesota. Last year alone, Minnesota collected nearly $760 million in tobacco revenues. Yet the state only spent about 1% of that total on tobacco prevention and treatment. That total includes our statewide quit tobacco services, which the legislature came together to fund in 2019. That was part one. Part two is Clearway Minnesota passing the tobacco prevention baton back to the state. We need to pick that baton up and not drop it. The two bills before you today would invest a small fraction of those revenues in preventing youth tobacco use and building a healthier state. There is a third funding option that has been referred to the tax committee as well. These bills provide this committee and the legislature with options for how to invest additional dollars in prevention efforts. The first bill, House File 569, would appropriate $15 million from the general fund annually to the Minnesota Department of Health to boost its tobacco prevention efforts. The second bill, which Chair Liebling referenced, does not have a House file just yet, and I appreciate your hearing it for efficiency's sake. This bill would dedicate a portion of the funds that Minnesota may recover from cigarette companies that haven't been paying their fair share of the tobacco settlement fees. A previous version of this bill was included in the chair's last omnibus budget, but unfortunately did not make it into the final one. And my testifier will share more details on that case. Investing in tobacco prevention and treatment will also help us combat systemic racism and tobacco-related health disparities. As you all know, late last year, the House Select Committee on Racism issued a series of recommendations on how to make Minnesota a more equitable and just state. One of their recommendations is to invest in a more robust and effective tobacco control program. These proposals would help us meet this need. Instead of spending just 1 penny of every dollar of tobacco revenue on prevention, we would be spending about 2 or 3 pennies. Looking at it this way, it's a tiny investment, yet that investment will pay dividends by lowering smoking rates, preventing youth addiction, and easing health disparities. With that kind of investment, we all win. Thank you very much for hearing these bills. I'll look forward to working together to find a solution to this funding gap.
Thank you, Representative Morrison. And there is one hand up, but I'd like to take testimony from Molly Moylanen, and then we'll go to questions if that's okay. So is that okay, Representative Munson? Or did you have a clarifying question?
Yeah.
Okay, great. Thank you. Okay, welcome to the committee, Ms. Moylanen.
Thank you. Thank you very much, Madam Chair and committee members. My name is Molly Moylanen, and I serve as Vice President of Clearway, Minnesota, an independent nonprofit working to reduce tobacco's harm. I also co-chair Minnesotans for a Smoke-Free Generation, a coalition of more than 60 organizations committed to ending youth tobacco addiction. For the past 20 years, Clearway, Minnesota has led a comprehensive effort to prevent commercial tobacco use through education campaigns, research, free quit smoking help, and community partnerships. The legislature has been a strong bipartisan partner in these efforts, passing smoke-free air, funding quit smoking services, and most recently, Tobacco 21. Our collective work has saved thousands of lives, prevented thousands of cancers, and saved Minnesota more than $5 billion. If Minnesota continues funding tobacco prevention at current levels or higher, we can save another 14,000 lives and $10 billion in healthcare costs. Clearway, Minnesota was created as a life-limited organization, and we will sunset at the end of this year. As we reach our sunset, tobacco remains a threat, especially when it comes to the youth e-cigarette epidemic and racial disparities. We are committed to working with the legislature on finding a sustainable solution. House File 569 is pretty straightforward, and the second funding option deserves a little bit further explanation. Now, as part of the 1998 tobacco settlement, companies agreed to pay fees to the state. However, in 2015, there was an industry merger which resulted in the transfer of some famous brands, including Kools, Mavericks, Salem's, and Winston's. Since then, these companies have not paid their share of settlement payments. The state of Minnesota is suing to recover these commitments, and the parties are currently in settlement negotiations. Securing sustainable tobacco prevention funding, no matter how we do it, will create a healthier future for Minnesota. We are grateful to Chair Liebling, to Representative Morrison, and lawmakers in both parties and chambers for exploring a number of possible solutions this year. The time is now. Thank you.
Thank you, Ms. Moylan. And just to close the loop on this, if the money comes from the settlement, from the lawsuit, and this bill is not in place, does that money, do you know where the money goes? Or it just goes into the general fund? Is that the assumption?
Chair Liebling, that's correct.
Okay. All right. Thank you. We've got Representative Munson and then Representative Grunhagen. Representative Munson.
Thank you, Madam Chair. This would be a question to Representative Morrison or the testifier. I'm in speaking with a group of police officers that represent areas across southern Minnesota. It came to my attention that the Tobacco 21 legislation that passed recently actually legalized tobacco use by minors, and where it was previously illegal. Now they're not able to enforce it when they find youth smoking, across from the high school and such. I know that this bill is actually, spending more money on prevention, but have you seen the impact of making it legal now for kids to smoke, and how that's changed as far as enforcement and, community awareness?
So, Representative Munson, this is kind of outside the topic of the hearing, but Ms. Moylan, can you respond to that? I know you're so well versed in all these issues. Go ahead if you can.
Thank you, Madam Chair, and thank you, Representative Munson. The Tobacco 21 bill, what that did was removed penalties on underage possession and use and purchase. And that was intentional. As we increased the tobacco age in Minnesota and across the country, as supported by legislators across the country and Congress and the former president that advocated for it, we removed penalties on underage possession and purchase and use. And that was intentional, so that we wouldn't increase interactions between young people of color, especially, and law enforcement. Law enforcement across the state said, we don't need to have that anymore. And we really want to focus the penalties on the industry that is responsible for addicting underage youth, not have the penalties on the underage users. So that's an answer, more of an answer to that question around tobacco 21.
Okay, Representative Gruenhagen. Representative.
Having problems getting.
Oh, okay.
Can you hear me?
Yes.
Yeah. Oh, thank you, Madam Chair. Yeah. And I just go back to, there was a tobacco settlement. So is what the testifier was saying, and I had to step away for just a minute. I apologize for that. Is that money completely gone now? And it's in litigation waiting for settlement? Or is it, or what's the status of that tobacco money? And again, I'm all for, regulating addictive products like tobacco. The only thing, when I was on the school board, and I know some of you are sick of hearing that, but we had a couple programs, Quest and Dare, and I used to ask for credible evidence that they actually worked. And, I'd be given a lot of comments, oh yeah, this works, everything else, but they could never produce studies that showed they actually worked. And that was troubling to me. But on the other hand, I guess I want to concentrate on the 15 million, because we had this tobacco settlement, and is all the money that was coming in that tied up in litigation, or where's that at?
I see that Mr. Berg is here too. Ms. Moylan, why don't you start, and then Mr. Berg can give us the numbers if you don't have them.
Absolutely. Thank you, Chair Liebeling, and thank you, Representative Gruenhagen. So the tobacco settlement dollars, 3% of those settlements originally were, as part of the settlement, created Clearway, Minnesota. In addition to that 3%, we were given a 25-year lifespan. So we will sunset at the end of this year. That was just part of the settlement with that 3%. The other settlement dollars that will continue to come into the state go to the general fund, and we'll continue to do that. It's about $150 million a year that comes into the state from the original tobacco settlement in 1998. Now, as I talked about with this separate settlement that's happening right now, is that in 2015, there was a merger between some tobacco industries, some tobacco companies. And with that merger, there was the transfer of a number of popular brands like Kool, Winston, Salem, and Mavericks. Since 2015, neither company has paid the settlement payments attributable to those specific brands. So the state sued those tobacco companies for the settlement payments since 2015 on those specific brands. And currently now all parties are in settlement negotiations for the delinquent settlement fees on those 4 or 5 brands.
Representative Gruenhagen.
Okay, thank you. That helps clear it up some. So.
Thank you. And just on that point, Ms. Moylan, so you said the 3% of the settlement supported Clearway. And now when Clearway sunsets, is that 3% dropping to the bottom line and going into the general fund, or what exactly happens to that 3%? Mr. Berg's shaking his head, but Ms. Moylan, can you answer?
Thank you, Madam Chair. The 3% that was originated, that was used to establish Clearway, Minnesota, that was about $200 million. And through our investments over time, we have invested all of that into tobacco prevention, tobacco treatment, awareness campaigns, etc. And so that is now, well, most of it has been spent and invested in tobacco prevention and control in Minnesota. And we're going to land that plane on the runway in time, on time.
Okay, thank you. I misunderstood you, I guess. I thought you were saying that 3% ongoing was going to support Clearway, but no, clearly not. Okay, Mr. Berg, did you want to add anything before we go to Representative Ryer?
Madam Chair, just to clarify, Ms. Moylan was correct on the numbers. Basically, the state gets, as of this year, $153 million. It declines slightly. It's a declining revenue source. It declines by a couple of $1 million a year. That is unrestricted revenue to the general fund. It is not dedicated for any purpose. Members tend to think some part of the tobacco settlement the state gets is dedicated for tobacco cessation. Now, that is not the case. The other thing I would just emphasize is what you were just discussing with Ms. Moylan, and members tend to think that somehow Clearway is affiliated with the state, or somehow the state is giving them their money from our settlement. They are an independent nonprofit organization that was set up by the original tobacco settlement. Their finances have nothing to do with the state of Minnesota, do not flow through the treasury, are not the state's money in any way. Just one final point is, originally the state of Minnesota had 3 large endowments with the the corpus of the original settlement. The state cashed those endowments in many years ago, and they no longer exist.
Okay, thank you, Mr. Berg. Ms. Moylan, and you look like you want to add something to that. Are we good?
Madam Chair, no, just completely agree and appreciate that clarification.
Okay, great. Representative Ryer.
Thank you, Madam Chair. So I have a question that may be either for Representative Morrison or Ms. Moylan. And we have 3 good bills here. One, again, and 3 alternative ways of funding tobacco, which I am completely committed to. So how are they interdependent? It makes a lot of sense to me to have multiple streams and attempts to see what actually makes it through. But I mean, if all 3 do, then we have an abundance there. How will you work through that? Or having none, I suppose, but we won't go there.
Representative Morrison, do you want to take a stab at it or ask Ms. Moylan?
Thank you, Madam Chair and Representative Ryer. I'll take a stab and I'll let Ms. Moylan add on. But I think we're looking to find a way at the end in an omnibus bill to make sure that we have funding money available for tobacco prevention and treatment. Ms. Moylan, and I'll let you add on.
Ms. Moylan.
Madam Chair, Representative Ryer, that is correct. We wanted to provide, in partnership with legislative leaders, options to pursue and to consider. And we were not putting out there the idea that more than one of these would be considered or finally included, but just again, wanting to really demonstrate that there are different solutions to get at this problem.
Thank you.
All right, well, thank you. Other questions? I'm not seeing any other hands. So just to talk for a moment about sort of process, since we don't have the second bill here, we're going to just lay over House File 569 for possible inclusion in the finance bill. The other sort of strategy, if it comes to us as a bill, it's fine. We don't need to hear it again. You've all heard it. Except maybe we may just bring it up quickly and lay it over for possible inclusion. But honestly, I don't even think that's necessary. When we go through our omnibus process, we could put that in as an amendment. I mean, the committee's had time to understand what it is. So there are lots of ways we can accomplish that goal, to have these different strategies on the table. So a lot to think about this here. And, as Representative Grunhagen pointed out on another bill, we don't know what the budget is going to be. It could be that we have some surplus funds available, so-called surplus, since obviously we don't account for inflation in our budget. But, we just don't know what situation we're going to be in. And this is very, very important. We don't, I think most of us are pretty committed to the idea that we don't want to let our prevention efforts fall apart here when Clearway is gone. So with that, seeing no other discussion, Representative Morrison is going to renew her motion that House File 569 be laid over for possible inclusion in the finance bill, and the bill is laid over.